Hello, this is Dr. Tom Clark from the Center for Weight Loss Success. I'm a board-certified weight loss surgeon as well as bariatrician, and I've helped thousands of people lose weight and keep it off for life. One of the common questions we get considering weight loss surgery is, what is life like after weight loss surgery? Let's talk about that. Now, we commonly hear, I wish I had done this sooner. Okay. But there are a few phases that people often pass through after weight loss surgery, and it may take a while to kind of get there, because initially in these phases they may think, what have I done? Phase 2 is, I can do this, because phase 1 usually passes fairly quickly. But phase 2, I can do this. And they're seeing good weight loss, they're excited, they're enthused. Phase 3 is finally, hey, I'm really glad I did this. Phase 4, I wish I could have done this sooner. But then potentially phase 5 is, I need to stay on track. Because after you've lost the weight, it's still some work to keep on track, keep that weight off. So there are some phases that people typically go through, but okay, this is fairly common, and most people wish they had done this a lot sooner. Now, some generalizations for right after surgery. And what we're really going to talk about here, some things right after surgery, and then some things long term. Okay? But right after surgery, yes, you're probably going to have some soreness. Most weight loss surgery now is done laparoscopically or through very small incisions. So the soreness, yes, it occurs right after surgery, but usually goes away pretty quickly, often within just a few days. You're going to be feeling like you can move around pretty nicely. Most people are no longer requiring any pain medication. After weight loss surgery, you do need that area to heal that's been operated on, so typically you need to be on a liquid diet, so you do need to spend most of your day sipping to stay hydrated, and then also working on your protein. Protein's important because you want to preserve lean body mass. We also want you moving. Initially after surgery, because you're moving a little slow, you're a little sore, walking. Walking is one of the best things to do initially, but then doing even more. But moving, that's the best way to prevent complications, specifically pulmonary complications, breathing complications. The more you move, the deeper you breathe, as well as this prevents blood clots. Walking is the best thing you can do. And then finally, resting. So often what I tell my patients are, these are the things you need to do at home: sipping, moving, resting. Resting is important. You do need some time to heal, but that doesn't mean you're spending all day in bed. No, you just need to stop and rest. Okay? Now, the typical food progression, and every surgical program will have their own little variations on this, but typically you're going to be on liquids for a couple of weeks. Then we graduate you to very mushy food, and it's just tiny amounts. So you use this mushed up food for a couple of weeks, and again, during this time your surgical area is healing. And then very slowly try solid food, and it's a slow progression to getting the solid food, and it really is just tiny amounts. So initially after surgery, tiny amounts. Okay. And then often people want to know, when can they return to work? Well, some of this depends on what you do, but most people are back at work actually within just a couple of weeks. Some people literally within a few days. If you do very hard manual labor, you may have to take a little more time off, but most people actually don't. So they can get back to work fairly quickly. Now, that's for the right after surgery. Now, what about for the long term? So thinking long term of kind of what's your life like, well, you've got to have some guidelines for long-term success. And what I've listed here then are some guidelines for that. First thing is eating. You don't want to skip meals. Skipping meals has never been a very good weight loss plan. So don't skip meals, especially don't skip breakfast. Think protein first. Protein's very important. Again, it's more satisfying. It's harder to digest, as well as it boosts your metabolism. And finally, you want to preserve lean body mass to keep your metabolism higher. Protein, very important. The concept of eating long term needs to be, how little can I eat and be satisfied, not how much can I cram in there. Okay? Because the difference between those two statements is about 20%, and that's often the difference between losing weight well or potentially gaining weight and keeping it off. Okay? Drinking. you want to avoid drinking with meals. And when this is one of the hardest behavior changes with eating, because what the concept here is you want a little bit of food to kind of fill your little stomach and stay there. So you avoid drinking with meals. If you drink with meals, well, you may overfill and be very uncomfortable, but also you may wash the food through. And if you wash the food through, one, you'll find you can eat more, and number two, you'll get hungry again sooner. With liquids, you want to make sure there are no calorie liquids. Water really is the best. I do encourage people to avoid alcohol and especially avoid carbonated beverages. Alcohol can irritate the stomach. It's also absorbed more quickly. There's lots of extra calories there. And then the carbonated beverages potentially can put stretch on the stomach, as well as there's generally nothing good in a carbonated beverage for you. Vitamins, take them every day, forever. That's the simplified version of my recommendations. Other things that can be helpful, besides just a good multivitamin, I do recommend people take essential fatty acids, B complex, as well as extra magnesium. All of these can just only help you, that most people don't get enough of any of these. Continuing the guidelines, sleeping, very important. If you don't recover, okay, you're not going to be able to kind of keep going, so to speak. Whenever we don't sleep well, the stress hormones tend to go up. It becomes harder to lose weight. We see the best weight loss when people are getting about 7 hours of good sleep every night. I know, easier said than done. Exercise, extremely important, and this should be a lifetime thing, at least 3 to 4 times per week for at least 30 to 40 minutes. As time goes on, you want to boost up the intensity and just keep going, make it a lifestyle. And then finally, it's up to you. It's personal responsibility. No one else can lose the weight for you. No one else can do the work for you. The surgery gives you a tool, but that's all it is. You have to learn to use that tool and practice using that tool appropriately for that long-term, lifetime success. But doing that, you're going to have a great lifestyle. You'll be able to do basically anything that you'd like to do. And that's the whole point of doing the surgery, losing the weight, getting healthier, but being able to do all the things we want to do during our life. Okay? So remember these things. Celebrate your accomplishments. Reward yourself with non-food related activities or things. And again, enjoy this journey of life. That's why we're here. Want more? If you'd like to receive all 21 free videos on the top questions you need to ask when considering weight loss surgery, go to our website, www.myweightlosssurgerysuccess.com. If you want more information on the Center for Weight Loss Success, go to our corporate website, www.cfwls.com. Thanks for listening. Have a great day. We'll see you on the next video.